WMJ-FM Bermuda, Magic 102.7. The opinions expressed on this program are not necessarily those of the ownership, management, or staff of Magic 102.7 or Inter-Island Communications.
And good morning to you, family. Such a pleasure to have you here with us today. As promised, we have with us the top brass, I guess, so to speak, at the King Edward Memorial Hospital. Vanetta Simons, who is BHB CEO, Dr. Edward Schutz, the BHB Chief Emergency and Hyperbaric Services, Judy Richardson, BHB Chief of Nursing, and Dr. Keith Kappa, BHB Chief of Staff. Welcome to you all. Thank you so much for taking time out of your tremendously busy schedules to join us live in studio. Of course, we covered a lot of ground last week via telephone, and thank you for that. So the purpose of today is to allow the general audience to ask any questions that they may have in reference to concerns or comments about the hospital. So we got some fantastic feedback based on the interview on Friday. Folks said that they learned quite a few things, and particularly in terms of the design of the hospital that they weren't aware of. Not everyone agreed with it, but what, if any, feedback did you get from our conversation on Friday?
I think we've had some feedback that people do have, as you say, a little better understanding of why the rooms are large, why there are single rooms for patients. So that's certainly been an issue. I think I commented last week that they hadn't been building hospitals with more than one patient in the room when I left the States to come back to Bermuda in '88. So we're really catching up to the rest of the world in terms of hospital design. One of the complaints I get in the emergency room many times is the rooms are too big, but those are multi-purpose rooms in the emergency department. So we can run a cardiac arrest in one of those rooms, we can perform a surgical procedure in one of those rooms, and by Accreditation Canada standards, they had to be a certain size. So, just in terms of the size of the rooms, that's something we really didn't have a lot of control with.
All righty. Dr. Ewart Brown called our show yesterday to comment on another matter, but in the conversation, and this was what he was commenting on was the Bermuda Hospital, the healthcare rather, press release that was sent out in reference to the cost of overseas healthcare. And he said that one of the reasons why persons go abroad is that, unfortunately, they don't have the confidence level in the local hospital. Then he went to go on and say, thankfully that is improving. We have a very good hospital, et cetera, et cetera. So let's speak to that lack of confidence sometimes that people have in the local hospital, number one. And then he also mentioned, I asked him about the shortage of beds issue, and he said, it might not be a bad idea to consider perhaps adding some more beds. So those two things. Let's start first with the perception that people have that the service and the care that they get locally is not where it should be.
Yeah, Sherri, what we did last year, we did run a public perception survey, and it gave us really good feedback in terms of the majority of the country does have confidence in the hospital. So certainly the statistics show that the majority have confidence. And then there is something about the confidence of not just individuals in our hospital, but is a confidence in Bermuda's entire health system, and we've always enjoyed incredible portability. I do get a lot of feedback, and as recently as when we held our big public town hall meeting in February, from individuals in the community talking about how much things have improved over time. What we're going through right now certainly doesn't help with confidence, because there are those individuals who are scheduled for surgeries and all who are not having them. And I had that feedback as I went in to work this morning from someone who understands that this is a crisis and understands why their surgery has been put off, but they're still having to feel the impact of it. In terms of adding additional beds, actually it looks like we have a lot fewer beds than we did, say, back before we opened up the new wing in 2014. But we did manage to open up 4 wards. We have those additional beds, and right now, as my colleagues have shared, we are possibly running at 120% occupancy over and above what we would normally experience. So I guess the message to get out from my point of view is we have an excellent team. I and my colleagues receive feedback on a regular basis. We're out there doing public perception surveys. Our town hall was excellent. We gleaned incredible information from the public. We're looking to continue that dialogue, and wherever we can, there's evidence that we are improving as fast as we can. There is one message, though, that I know that we'll repeat over and over, and Dr. Schultz will speak about it in a minute, and that's how is the population of Bermuda changing? How is our need for health care changing, and what impact is that change having on not just our hospital, but on our providers, period? So whether the general practitioners or other providers in the community, where do you draw that line between what we should be expecting from an acute care hospital and what we should be expecting from the other providers? The other thing that I want to add, and it would be remiss of me not to say it, is that even our mental health services, our acute care ward at MWI is also over capacity right now. So it's not just about our ACW, it's all of our health services right now are over capacity.
Is there a reason why your mental health services are being extended to the degree that they're being taxed? Are we seeing an increase in diagnosis? Are we seeing, is it have to do with the stress of the economy? Is there any indicator as to why you're seeing this jump?
I mean, those may be factors. I mean, we do have a very high instance of psychiatric disease in Bermuda for our population base. And in past years, a lot of patients have been transferred from the inpatient setting to the community. This is happening all through North America. In times of stress, some of those patients may require admission to the acute care psychiatric hospital, and I think that's what we're seeing. Certainly, there's lots of stressors in our community right now. There's unemployment, there's the cost of living. Those are issues that can affect people adversely with psychiatric disease.
All right.
I would like to just speak again to the confidence issue from a clinician's point of view.
Surely, Doctor, but just before, I just want to remind folks that now is the time for you to ask your questions. Family, lines are open at 297-1027. That is really the purpose of today's show, so you'll get your questions in via telephone. Also, you can send any questions or comments to Sherri, SHERRI.magic@gmail.com. Back to you, Doctor.
So the issue about confidence, I think unfairly sometimes we are compared with hospitals in the U.S. where patients are referred, and we refer our patients to some of the pinnacles of medicine in North America. Mass General, Leahy is certainly an outstanding medical center, Johns Hopkins in Baltimore, and we are at the end of the day a community hospital for a population base of about 65,000 people. I think we provide outstanding services. For an isolated community hospital, we provide many more services than you might find at community hospitals throughout North America. We can't do everything, but I think we're very good at many of the things that we do.
All right, let's go to some of the questions that have come in via email. This listener writing, the issue with room shortage at the hospital occurred almost immediately upon inception of the opening of the acute care wing of the hospital. Ms. Simons, are you telling the Bermuda public that you were not aware of any issues regarding this particular issue? Were the hospital staff not aware that going from 300 rooms to 90 would create a problem?
So we didn't go from 300 rooms to 90 rooms. The hospital has a total of about 400 plus beds. What happened, we had the continuing care unit that was still there physically, and at that particular time we hadn't scheduled to knock the building down immediately. We had a hurricane that the building incurred a lot of hurricane damage, and we advanced the plan to knock that building down. Had 2 floors that were decanted. Those patients moved into our acute care wing, and we managed to use the 4 wards that were vacated for the CCU patients. But in addition to that, we had overflow beds that were also made up in that overall complement. So let me get back to the question about the 90 beds and hopefully put it to rest. BHB is an acute care hospital in its core. We've expanded to become more based on the needs of the country. But even when the original hospital was built, whether it was in 1920, the 1960s building, the 1998 renovation, or the 2014 addition, it was always to project to provide for acute care needs.
Can you explain to the audience what an acute care hospital specifically, what the design is of that?
Okay, so
I mean, basically, an acute care hospital provides acute medical services for people, acute medical illness, asthma, diabetes that's out of control, heart attacks, strokes, acute surgical injuries, surgical conditions, appendicitis, somebody needs to have their gallbladder out, somebody's involved in trauma and is brought to the emergency department and needs to go to surgery. Most acute care hospitals do not provide long-stay nursing home beds. And for years and years and years, we've had to do this because there's been insufficient beds in the community to meet the need. That has impacted. It has now come to the point where it's impacted our ability to provide acute care services.
Okay. So that would also, so people understand the distinction. Yeah.
It would also include those planned surgeries that we talked about. And acute care stays also your maternity and your ICU patients, and in our psychiatric services, it's the same thing. So the average length of stay for someone in an acute care hospital is definitely under 7 days. So basically, it's anyone who requires care, rather than it being the exception to the rule, but requiring care for longer than those 7 days.
Yeah.
So individuals who were there, for living at BHB, that's not acute care anymore.
Yeah.
In the U.S. setting, you would only be in an acute care hospital for a few days, and then if you required a longer period of rehabilitation, you would be transferred to a step-down center such as a rehabilitation hospital or a nursing home setting. You wouldn't stay in that acute care bed. We don't have the luxury of those beds being available in this community.
All right, let's go now to the phone lines. Welcome. You are on air. Good morning.
Hi, good morning, Sherri. I just wanted to, first of all, I want to congratulate the 4th floor of the hospital. I just came out of the hospital with PEs in both of my lungs and a blood clot in my leg. And I had excellent care on the 4th floor, right from the cleaning, right along through. My question is I realize that it's so busy and it's so much for the nurses and the aides to do. Why isn't the old hospital floors renovated one by one and you hire more nursing aides or assistants to operate in that area with one RN or something like that, or people that need to stay in the hospital longer? Because I came home, my to me wasn't where it should have been. I felt like I should have been in hospital. I was actually scared to come home, and I knew that beds were needed, and I had help home, so I could have come home. But not everybody is in the position that I was in. So my question is, why isn't the old hospital being renovated floor by floor to accommodate those patients that may be in my condition or who need stability and diabetes, which don't need to be the acute care wing, and have more nurses aides that can assist them by giving them the bedpan and stuff like that, people that's on bed rest or something like that.
Okay.
That's my question.
All right. Thank you.
That's an excellent question. Right now, the hospital, what we're doing is we're working on a clinical services plan. We want to make a recommendation to Bermuda, to the minister, but mostly work with the community to understand exactly what is needed for services in the community, not necessarily at the hospital. And you're absolutely correct. You're dead on. We as a community, I'm going to speak with both hats on, we as a community need a rehabilitation unit. We call it a step-down unit. The question becomes whether that should be in BHB or whether that should be an external business, whether private sector should be providing something like that. And you are absolutely correct. That is part of what's causing this crisis internally, but the crisis is also external in that our country doesn't have enough services. So we're doing a clinical services plan. We're looking to have it completed by December, and throughout this period from now until December, you will hear that we're engaging the community more and more so we can better understand what those needs are.
For those of you who are just joining us, we have representation from the Bermuda Hospital Board, so that's right, the King Edward Memorial Hospital, and the Mid-Atlantic Wellness Institute. They all fall under the same umbrella. This is your opportunity, family. I'm so glad to see that the lines are lighting up. So if you have any questions or comments, don't hesitate to do so. Now is your time. Let's take a break and we'll get back to our callers following this message.
95% of Bermuda's households have now been counted. Is yours one of the 5% still not counted? If so, complete your census information now. It's quick and easy and required by law. Call 297-7761, visit the Department of Statistics, email statistics@gov.bm, or call the number on the card left at your home. That number again is 297-7761, a message from the Department of Statistics.
Moongate Insurance offer a supplement to plans like HIPPO Future Care. Our Health Gap supplement helps with your copay and includes full air ambulance coverage worldwide. It also includes local discounts on dental, vision, prescription, doctor visits, and more. To learn more about us, give us a call at 542-2200 or visit us at moongatebda.bm. We're located on the ground floor of Sophia House. I'm Hope Johnson. At Moongate Insurance, we're here to help you.
Flowers by Jimmy. For every reason, every season, every special occasion. Celebrate you. Celebrate others. Celebrate life with something beautiful.
Flowers by Jimmy. Best of Bermuda winners and exclusive distributors of Nest products. 37 Front Street, Hamilton. Call 297-4464. That's 297-JIMMY. Beautiful bouquets of flowers by Jimmy, also available at Miles Market.
Give the gift of flowers. Give the gift of love. Flowers by Jimmy, delivering personalized service.
And this is my minute. With less than 100 days to go to the 35th America's Cup, have you bought your tickets yet? Maybe you don't know which category to buy or which days to go. I'm here to help. Every day in AC35 will be a good day, but opening weekend will be one of the hottest. Oracle Team USA take on Groupama Team France in the opening race, and it should be a thriller. There promises to be incredible action on the Great Sound from opening weekend until the final dates, so you really can't go wrong. Now ticket categories. The America's Cup Village tickets start at $10 for Bermuda residents and $5 for children. The Grandstand starts at $70 and guarantees you a seat and entrance to the America's Cup Village, complete with big screens so you won't miss the action. If you want to be on the water, an official spectator boat ticket is what you need. They start at $150 per person. VIP experiences include the Longtail Lounge with an open bar and lunch buffet. Email hospitality at America's Cup to book it. There's also the Gosling's Dark and Stormy Island Bar, which includes a buffet lunch starting at $150. Finally, if you have your own boat, register for a flag online. Boats under 40 feet are $35 for the whole event, and boats 40 feet and over are $15 per foot. For more information on tickets for the 35th America's Cup, visit americascup.com/tickets. I'm Michaela, and that's your minute.
And remember, we have America's Cup in the house every Thursday leading up to the event. So Danielle and crew will be joining us this Thursday at 11:30. Let's go now to the phone lines. We've got some callers on hold, so we ask that you please keep your question or comment brief. Hello, welcome. You are on air. Good morning to you.
Thank you, Lady Sherri, and good afternoon. Yeah, so good afternoon, it's 12 o'clock. Good afternoon to my colleagues. I'm former orderly at the hospital way back in the 60s. Things has changed a whole lot. But there's a question that I want to put forward to the doctor. Surely, sir, there must have been warnings. You must have known that there was warnings that the hospital will be short of beds before this came in the papers. You must have known something might happen. Secondly, in the old hospital, in the Harbor Ward, Cooper Ward, Curtis Ward, can those wards be used again at any time? Thank you very much.
All right, thank you.
I think we have always had concerns about beds. The problem is the bed demand is going to continue to increase, and that is linked to the fact that we have an aging population. So the projections are that in the next 10 to 20 years, we may need to increase capacity by up to 10 to 20%, which is sort of frightening statistics. However, it's always a balancing act between resources that you have and what you want to build and what you want to have for the community. So, you know, we do the best we can. I think there are always going to be concerns going forward that we're going to have challenges in meeting the demands of this community for beds. The fastest growing segment of the population is people over 85. We know when they attend the emergency room, about half the time they're going to end up being admitted. The good news is people are living longer. The bad news is we're living longer with multiple chronic diseases, and we're likely to spend more time hospitalized in the future if we live long enough. So, you know, that's sort of the setting in which we opened the new wing.
All right, let's go back to the lines. Thank you for holding. You are on air.
Yes. Hi there, Sherri. I'd like to address my concerns to the team. I just want to say this. Why would you all go from a 200-bedded hospital down to a 90-bedded hospital? I really can't understand that.
First of all, I think those numbers keep getting thrown around. So we never had a 200-bed acute care hospital. We had an acute care hospital for about 100 beds, and the other 100 beds were extended care or continuing care unit beds, which were nursing home beds. What happened unexpectedly was we lost those beds. We are not being supported in terms of funding for those beds, and the building's roof blew off in a hurricane. So we lost 100 beds that we hadn't intended to lose from the overall process. We would, if we had those beds and that unit was still open, we would be in a better place right now, but we've taken the old wards, which are now fully in use, with those 100 patients who were transferred from the continuing care unit. So as Ms. Simons tried to say, our total bed numbers are approximately the same. The problem is we need more demand than that. And if we hadn't lost the continuing care unit, we would have had access to those beds, but we don't have access to those beds anymore. The building was riddled with termites. It could not be repaired at reasonable cost, and the roof literally blew away in a hurricane.
And I would just like to add a little bit to what Dr. Schultz said. Our current building that we're all using, and every single bed is full, whether it's on maternity ICU or the wards where our long-term care patients are, even that building needs to be upgraded, continues to have floods and all. Remember, we re-provided the acute care beds because of the number of times care was disrupted from floods or various things happening in that building. That building is still in need of repair. There has to be, and I just want to put it back out there again, there has to be a focus on the community providing more beds from the community. when individuals are discharged at the end of 7 days, somewhere between the 7 and 15, we require to have beds in the community, whether they're rehab beds or long-term care beds. There needs to be more in the community that we discharge to.
So
Even
what about,
BHB's provision of long-term care was done in response to the fact that there were no beds in the community, so someone came and said, could you do it? But there has always been the intention to move long-term care back into the community. It's just not happening fast enough. And just to add a point to what Dr. Schultz said, was this known previously? All of us can go back to the Arthur Anderson report from several years ago that predicted long ago that, yes, Bermuda would be at this point right now, and Bermuda would be challenged, not just the hospital.
All right, Cola, was there anything else that you wanted to ask?
So right now the focus is on beds. I would think maybe the two government facilities can assist in some way and free up some beds, to help the hospital in some way. And also, the patients that are not quite ready for discharge. And also you might get some tourist facilities, people who have a lot of room, and
we're actually
people that, like I said, are not ready for discharge, and who can still come to the hospital as daycare to receive whatever.
All right, thank you so much, caller. So we are working with our stakeholders, and Sylvia Richardson and Leif Royhouse at this point in time are in discussions with us. We're meeting on a regular basis in the hopes that we'll be able to develop an assessment tool where we'll be able to screen all patients who are admitted to nursing homes, rest homes, facilities, whatever. So we're having some collaborative effort to push that forward right now. And we also hope that some of the entrepreneurial spirits that are in the community will also be part of this continued communications, with hope that we'll be able to open some facilities for patients who probably don't need skilled nursing care. We're staffed at this point in time to take care of patients who need skilled care. There's, independent levels of care that could be better cared for in the community at this point in time. And some of those patients are the ones that would do better outside in the community as well. All right, let's take a station ID, and we'll come back to the emails and the phone calls.
102.7 WMJ-FM Bermuda, Magic 102.7. The opinions expressed on this program are not necessarily those of the ownership, management, or staff of Magic 102.7 or Inter-Island Communications.
And let's get back to the phone lines. They are lighting up. Good afternoon. Welcome. You are on air. Please keep your question or comment brief.
Thank you, sis. I appreciate you allowing me this time. Good afternoon, guys. I just wanted to ask a question when it comes concerning to percentages. Now, with this America's Cup coming, in every incident when a country increases in percentages of visitors, with all these ships and this America's Cup going on, what are we going to do with the fact that we're now allowing tourists, we're going to be driving four-wheel vehicles, and with the shift and everything that are going on? Looking at percentages, there's a good chance that accidents will increase. If there's 8,000 people, the percentages may be an eighth of that 8,000 people that we'll have an accident with on a week-to-week basis. Is Bermuda going to be subject to Bermudians being forced to move out of the hospital to accommodate our guests, which history shows in most cases Bermudians are put last and our guests are taken first in fear of being sued and stuff like that. What provision is being put in place right now? What are we going to do? Thank you.
All right. Thank you, caller.
Thank you for that question. There were points that you made that I can't answer, but what I will answer is that Yes, the hospital has to take into consideration all of the challenges that America's COP might bring in the way of our population being expanded. And one thing that our team, we sat down and we considered, can we sit here and say, no, we're not going to take care of individuals who come to the island? No. So what we did is we brought in all of the lead representatives from America's COP, and we did our own internal projections about what we think might happen based on our knowledge and experience from when Bermuda's tourism numbers used to be a lot higher. We know exactly what the experience was then, so at least we could accommodate it. So what we've done is we pulled together a disaster response team in case Bermuda has a major disaster, so we are prepared for that. In terms of the numbers, and you're absolutely correct, we are anticipating that it will increase the number of patients at that time. The difference with America's COP is that we know it's coming and we can plan for that, so we can work with our surgeons and various individuals to plan for that and hopefully provide enough capacity so we can handle that additional demand in the community.
Bouncing off of that question, we did get a similar question via email. Ms. Simons, can you please speak about contingency plans in the event of a disaster? Now, you touched on things that you know are coming. What about acts of God? What about things if there is, like, for instance, that major fire that was on Front Street some time ago? What if that, thankfully no one was injured, but, you know, that could have been a lot worse.
So that's a great question. And, you know, we are a very isolated country. We have the potential for air diversions here with a large number of casualties from an aircraft instance. We have over 40,000 overflights, I think, every year. So, you know, we train for these eventualities. In point of fact, this very week, there's going to be a major disaster exercise with on-water activities to test our preparedness for America's Cup. So, you know, we've been planning for this for months. We hope that there will not be any large events associated with America's Cup, but we realize that there is a potential for large numbers of people to be in a fairly isolated part of the island with one road in and one road out. And we have already designed a way to deal with that employs transport of patients on the water with government resources, and that will actually be tested this weekend. So, you know, yes, we have concerns. Yes, there will be more people, but, you know, I recall when we routinely had far more people on the island during the summers when tourism was good, and we had, I think, 80% more hotel beds than we do now. So, you know, in terms of the numbers of people we're going to be dealing with, this is not anything new for Bermuda. Our total number of hotel beds are still down. That limits the number of people who are going to attend this event, and it's highly unlikely we'll have more than 10,000 more people on the island. And this is a busy time of the year anyway, when you have cruise ships and you have tourists on the island, and you have increased bed occupancy at the hotels. So we know that we are going to be busier during the summer months, and we have tried to plan to the best of our ability to deal with increased volume over this period of time. We've hired additional physicians for this period of time. We have canceled elective surgery for this period of time. So, yes, we're making preparations.
Yeah. And this is during the, you said canceling for this, what specific period of time are you referring to?
This is basically a 1 month period from the 23rd or 24th of May to the end of June. And now the events might finish sooner than the very end of June. There's some special days that are set aside in case they can't race each day. But basically, it's a 4-week period.
All right. Let's go now back to the phone lines. Thank you for your patience. So feel free to call back at 297-1027. Remember, email any questions or comments. Send them to Sherri, SHERRI, .magic@gmail.com. Let's try those phone lines again. Hello, good afternoon. Welcome. You are on air.
Hi, I called earlier and Ms. Pyramid Love and had answered my question, but I want to piggyback on something because what I thought I heard was that if there is a rehabilitation area that the hospital may be looking at, is something that I got the impression that it was going to be outsourced. And if that is outsourced, how would this affect the person that has insurance? Will that be part of the discussion? Because the insurance company may cover a hospital, but if somebody wants to independently have a private clinic or take that entrepreneurship on, how is the insurance gonna? How is the individual gonna have their insurance covered? Should they be in that rehabilitation area? So I just want to touch base on that because I got the impression that the hospital is looking at it as being outsourced instead of coming under the umbrella.
All right. Thank you, caller. So I'll answer that one. The clinical service plan is an initiative that we're taking on right now at the board so that we can explore all of the services that we currently provide and any new ones that we should be providing. At this point in time, we'll get the involvement of all of the internal staff as well as stakeholders in the community. And pending the outcome of that review, we will then make decisions on what the hospital should be providing for our patients. There may be some services that we will not continue to provide, or some new entrepreneurial adventures for people in the community to take on, but we certainly know that there's a lack of rehab both in the hospital as an inpatient acute rehab unit and outside of the hospital. All right, for those of you who are just joining us, we have with us live in studio answering your questions, Vanetta Simons, who is the CEO of BHB, Dr. Edward Schultz, BHB Chief Emergency and Hyperbaric Services, Judy Richardson, BHB Chief of Nursing, and Dr. Keith Kappa, who's been very quiet with us. He's still in the room. Haven't forgotten about BHB Chief of Staff. Did you want to add anything?
Yeah, I just wanted to add, because I hear the concern being reimbursement or compensation for, well, the question is who is going to pay for any activity that's outside of the hospital. And right now the insurers do pay for activity outside of the hospital. If we just look at it, I guess on its simplest level, what we are thinking, what we're expecting, or the assumption we have going into the planning is if you offer services from outside of the hospital being a really expensive resource, the thought is that maybe it could be offered less expensively. Certainly the insurers pay when you go overseas and you have step-down care. They pay, I think, for the first 40 days of rehab if you have a stroke and you need rehabilitation. So that's why Judy was saying, our chief nurse was saying, that we will work with the community. It's not just individuals in the community, it's also the business community, the insurers, so that we can restructure the way care is provided in Bermuda and also restructure the way care is paid for in Bermuda. And you're absolutely correct. That's one of the biggest questions that comes to me when individuals want to put up more long-term care rooms. They want to know how it's going to be paid for. Those are questions for the insurers and for the Ministry of Health.
And let's go now back to the lines. Welcome. Good afternoon. You are on air. Please turn your radio down.
Sorry about that, Sherri. I just want to thank your guests, and hopefully we can hear more from them in the future, even after this crisis is over, because there's always ongoing questions that, although we can go to the Health Council, getting it directly from the BHB board is very helpful. So I just wanted to thank them. I don't have no questions.
All right. Thank you. Yeah, lots of these questions that folks have been wondering about. Now is your opportunity to get it directly, as the old saying goes, from the horse's mouths here. Get your questions answered. This listener writing, "Hi, Sherri and guests. Shouldn't we be putting more emphasis on preventative health care to reduce the level of illness we are seeing in Bermuda?"
I couldn't absolutely agree more with that statement. The big issue we have in Bermuda, and it's not just in Bermuda. Again, you know, we often think that we have a unique situation, but we share this same challenge with all the developed nations of the world. The greatest crisis we're facing is simply because we are living longer, we're getting more and more chronic diseases, and those diseases have to be managed optimally, and if they aren't managed optimally, people end up with very serious complications from the disease. Their quality of life goes down. They're going to face longer periods of hospitalization. So our goal should be to put in preventative measures, and the one disease, if I wanted to target one disease in Bermuda, it would be diabetes. In my humble opinion, diabetes alone has the potential to bankrupt this country if we do not manage it appropriately and prevent preventable complications from the disease. An example I use, I had an aunt that had diabetes for 50 years. She was well controlled. She lived to be 87 without any complications of the disease. Every day I see patients who had diabetes for 5, 10, 15 years, poorly controlled. They end up on dialysis. They end up with amputations. They end up having premature heart attacks and strokes and loss of vision. Much that needs to be done in this community is to put in preventative measures to avoid these terrible complications from diseases. We have guidelines for the management of diabetes in Bermuda. The Department of Health and the physicians in the community spent a lot of time in developing those evidence-based guidelines, but I often find that we're not following our own guidelines in managing diabetes, and that's just one example of the diseases, the chronic diseases that face our community.
And we'll be back with our in-studio guests following this break.
Are you looking for new tires or in need of a tire repaired? Do you want the best price and the best quality tires with the leading brands such as Bridgestone, Goodyear, Firestone, Kenda, and Interstate? Come on down to Island Construction Services, where our friendly and knowledgeable staff take pride in providing the best professional service in Bermuda. Let us have you back on the road in no time. Located at Island Construction Services, open from 7 a.m. to 7 p.m. Monday through Saturday. 79 Middle Road, Devonshire, just across from Christchurch, or give us a call at 236-3011. And remember, best quality, best price, best staff.
The 14. Port Royal and BF&M present Golf for Life. It's a wonderful opportunity to bring your family and friends together for a stimulating social experience and recreational activities through Golf for Life. Join us Sunday, May 7th at 1 p.m. It's family-friendly, fun 9-hole Captain's Choice Golf Tournament. $75 per person includes green fees, a chance to win great prizes, and a delicious meal at Bella Vista Grill. Tournament participants and beginner golfers are invited to come experience our free golf clinic, especially if you're interested in learning golf. Yes, our Golf for Life event will host a free golf clinic at 1 p.m. with Port Royal teaching golf pro, yours truly, Tim Swan. Golf for Life registrations are being accepted now by emailing timswangolf@gmail.com or call 533-8321. Golf for Life.
Channel 82 is looking for 4 people to be part of a new project being produced by Crimson Multimedia. Have you ever wished you could write a comedy for television? If you have said yes to this question, then send your name and contact information along with an original short story. Also, make it funny to Mr. Magic Channel 82@gmail.com. And again, make it original.
And we are back with our in-studio guest, CEO of the BHB, Vanetta Simons, Dr. Edward Schultz, Chief of Emergency and Hyperbaric Services, Judy Richardson, Chief of Nursing, and Dr. Keith Kappa, Chief of Staff. Let's go back to the phone lines. Thank you for holding. Good afternoon. You are on air.
Good afternoon, ma'am. I'm just wondering about their property that they have up there here in Nessus Quarters used to be. What they're going to do with that?
Can you repeat the question?
Yeah, I'm sorry.
I said the property that you have, the old nurses' quarters, what's going to happen to that? Are they going to use that for office, or they can use that for like a care center for seniors?
All right. Well, thank you for that call.
Yeah, thank you for the question. Yes, you will see a lot of property that's been cleared around King Edward and the ACW and the general wing right now. You might have heard me speak early about the clinical services plan. Bermuda, we first need to figure out which services we need before we begin to plan out what we're going to put on the estate. There's a challenge we have sometimes about building an estate and then putting services into the estate. And we've already made a huge investment in the ACW, and it's really important that we understand which services need to be on BHB's estate, close to the acute care, and which need to be spread throughout the country. So you are correct. It's there. What we've decided to do is just clear the property, use it for parking for now until we have a plan. We'll begin our estate planning in January of 2018 once we have the clinical services plan.
This listener writing via email, good day. What I find alarming is that you're saying that you're asking us what is needed. Based on worldwide best practices in your professional capacities, wouldn't you be able to determine the needs of the community?
Absolutely. We do know from our perspective and our experience, and there are several years of experience in the room today, we do know what is needed by the community. We know that there needs to be more prevention. We know that there needs to be more services in the community to support those who are chronically ill or who need care as they age. We did hold a town hall in February, and in that town hall, we heard about gaps in care, not just gaps in care because the services aren't provided by the Bermuda Hospitals Board, but gaps in healthcare services in Bermuda generally. So it would be presumptuous of us or arrogant of us to think that we know everything about the needs, because we're not Bermuda Hospitals Board. If you read the Hospitals Act, it isn't there to provide for all of the needs of Bermuda, and it's really important that we understand the difference between our perspective and between what the community feels it's needed, and then we can speak to both.
This listener writing, how do people in the private sector who want to assist with deployment of additional physical facilities for hospital and Maui engage with the system?
I've asked, and several individuals have come to me over the last few years who were interested in offering additional services. Those that are looking to directly partner with BHB, yes, certainly you can come directly to me, email me directly on that. But there are some services that I might redirect you about. I will redirect you to the Ministry of Health, because not everything, again, is within the remit of Bermuda Hospitals Board.
Let's go back to the phone lines. Welcome. You are on air. Good afternoon.
Good afternoon, Sherri. Good afternoon to your panel, and good afternoon to Bermuda. Yes, I've had some visions on that hospital. I mean, like foresight, layman. From the nurses' home all the way to the new wing of the hospital. I would have figured that an architect, or someone would have designed that from knocking down the ill nurses' house and straight across on top of the laundry, or just stacks up and straight across to the ill wing and right over to the new assistant part. And then you could have had everything in that whole area. But I thought that, you got people that's money, you got people that's brain. I got common sense. And to me, it would have made more sense to just, what is this, the whole complex from Jump Street, like the lady said, shut off a floor at a time or 2 floors at a time through the whole wing, the whole hospital, because that's a hospital there. I wasn't born in the hospital, but I spent some time as a young kid. And that hospital there is one of the strongest structures in the world, even out Bermuda. And I can't see them knocking that down. So my point is saying, why would you not link everything together and make it one whole big complex? Even if you would have had to take a little part from Botanical Garden.
All right. Thank you so much, caller. Let's start with part of what he said towards the end of his comment, the structure itself, saying that old part was one of the strongest structures.
I again appreciate your views and your comment. The current structure, the general wing that was built in 1960, it does look good. We keep it looking as good as we can. It's well maintained in that fashion. What you don't see beyond the steel structure is the fact that it has iron piping throughout that continues to fall apart, and we suffer with floods. The floor to ceiling ratios and all, they weren't appropriate, and there was a lot of public engagement when we did the ACW where we talked about these things. What we did do, I can talk about what we didn't do, and that general wing, even now, if I could, I decanted so that we could renovate it appropriately. If it was worth it to renovate it. But we have to provide 24/7 care, which does not give you that opportunity to shut it down and renovate it at the appropriate level. What we did do, however, was make sure that all of the property around the hospital, including the hill where the parking is, has been already approved to be developed. And when the designers designed the ACW, it was designed with the intent that if we needed to build a second tower at some point in time, if it's 20 years or 30 years, it is already designed to accommodate it and to integrate into that building. So you're definitely spot on in terms of the design being something that will withstand time. That building has been designed for 30 years, and we try to project as best we can to make sure that the property was flexible.
All righty. This listener wanting to know, and I believe this is probably for Ms. Simons, what is the lady's email? And I think the listener was referring to you, because this is for opportunities to liaison for, opportunities for services, etc. So who would they need to reach out to?
Yeah, they can reach out to me directly if they're looking at partnerships with Bermuda Hospitals Board, if it's definitely something that they feel could integrate with our services. So you can find my contact details on our website at bermudahospitals.bm. And I can give you my very long hospital email is vanessa.simons@bhb.bm or at bermudahospitals.bm. But you can go to our website, and that's the best way.
All righty, and I tell you, thank you so much, family, for calling in. And it has, believe it or not, been an hour. Look at that. And it's wonderful because the calls have just stopped just now, so that's a good point for us to wrap things up. I know that all of y'all have to get back to your busy hospital there. So what would you like for the general public to know in a nutshell?
In a nutshell, well, there was one point that I have to make. One caller said that whether or not Bermudians were going to come first. And what Dr. Schultz and all of us, this is how we practice and how the Bermuda Hospitals Board practices, period, who comes to our doors in need, those are the individuals who come first. They're prioritized in emergency. I want to also thank our staff. I mean, there are 1,800 individuals who work down at BHB every single day. And whether it's at MWI, the Urgent Care Center, or at ACW or a general wing, they're working their hardest right now to make sure that we're taking care of individuals. Understand that the crisis is, yes, inside of BHB, and we're managing it, but we're managing it with your help. When we call you and we say that your loved one is ready for discharge, be available and collect your loved ones, whether you're the family or whether you're a rest home. And all of the other providers out there, we need you to handle this as a crisis as well. Think about maybe what you can do to keep individuals from coming inside of the hospital right now. It's what we need to do anyway, so this is really a catalyst to the way that we need to be working going forward.
I'd just like to thank the public, again, for being very understanding. We know there have been some long delays, both getting into the emergency department to be assessed and also getting out of the emergency department to award. We're quite aware of that. Our staff has been working really hard. We've got a fantastic staff in ED, but despite their best efforts, there have been times we just don't have the beds. The other thing that I would say in support of what Mrs. Simons has just said is that most front door issues in the emergency department are really back door issues. If there are no beds on the wards because people are in those ward beds that don't need to be there, I can't get people's loved ones into beds in the ED and out of those beds onto the wards. You know, there's only so many beds in this community, and we must turn those beds over for the sickest patients in our community who require acute care beds.
And we want to thank the families and the public for being patient. We know that it's very difficult when it's your loved one that's involved, but we do have a high demand right now. We're doing the best we can, and all of our patients, especially those who have surgeries booked, who right now are on hold, unfortunately, we're working to reschedule. They may not get in this week at the time that they were expected. We will reschedule surgeries, and you can have the conversation with your health care provider for any options to that.
Now, on that, the rescheduling of surgeries, now this is strictly elective surgery. If you come in needing emergency surgery or you're still,
These are elective surgeries.
Elective surgeries, yeah.
These are surgeries where you've decided your hip needs to be replaced at this point. Your cataracts are now to the point you need eye surgery. These are purely elective surgeries that are being canceled.
Yeah.
We would never
So rest assured, if it's an emergency situation, you will be attended to.
You will still have
absolutely
access to the OR. Okay. Absolutely.
All right. Anyone else wanted to add anything? Thank you so much. Appreciate your taking the time out. And we've got to do this more often.